I'm sure by now, like me, most of you would be worried, concerned, and even confused about the new coronavirus variant Omicron and how it will impact your life. Now, there are many news reports, some even conflicting, but what I have got for you today in this video are the 10 pointers of the most important information pieces about Omicron straight from the World Health Organization, which is the global health authority of the United Nations that's responsible for the international public health. But before we proceed, here's a gentle reminder for all of you to connect with me on Instagram if you want to chat with me, and please subscribe here and please hit the bell icon if you've already subscribed here to never miss an important story. So, without much ado, let me just begin with the point one. Well, it's not clear whether Omicron is more transmissible, that is, more easily spread from person to person, according to the WHO. Point number two, there is currently no information to suggest that symptoms associated with Omicron are different from those from other variants. Number three, it is not yet clear whether infection with Omicron causes more severe diseases compared to the infections with other variants, including the Delta variant. Point number four, preliminary data suggests that there are increasing rates of hospitalization in South Africa, but this may be due to increasing overall numbers of the people becoming infected, according to the WHO, rather than a result of specific infection with Omicron. Point number five, according to WHO, preliminary evidence suggests that there may be an increased risk of reinfection with Omicron, that is, people who have already or previously had COVID-19 could become reinfected more easily with Omicron as compared to other variants of concern, but this information is limited according to the WHO. Point number six, current vaccines remain effective against severe disease and death. Point number seven, the widely used PCR tests continue to detect infection, including infection with Omicron. Point number 8, according to WHO, it encourages countries to contribute the collection and sharing of hospitalized patient data through the WHO COVID-19 clinical data platform to rapidly describe clinical characteristics and patient outcomes. Point number 9, according to the WHO, countries should continue to implement the effective public health measures to reduce COVID-19 circulation overall using a risk analysis and science-based approach. And finally, point number 10, the most effective steps that you and I can take to reduce the spread of COVID-19 virus is to keep a physical distance of at least 1 meter from others, wear a mask, a well-fitting mask rather, open windows to improve ventilation, avoid poorly ventilated or crowded spaces, keep hands clean, cough or sneeze into a bent elbow like this, and get vaccinated when it's your turn. This is what I thought was the most comprehensive and complete list of important pointers from the World Health Organization that is in fact listed on their website. There's a lot of information, but I took out these things because I thought they were more important. For specific information on travel bans to and from your country, you can check out airline and specific country websites. But as of now, many countries have closed their borders to incoming passengers from South Africa, including the UAE and United States, Britain, Saudi Arabia, Kuwait, and the Netherlands. Now, the UAE suspension includes the entry of travelers from specific countries in South Africa during a period of 14 days before coming to the UAE. However, flights are allowed to transport passengers from the UAE to these countries, according to the reports in the local media. The UAE also allows the transfer of excluded groups, which include official delegations and UAE citizens, diplomatic missions approved between the UAE and the countries that are listed in the reports, and holders of golden visa for the UAE. India, meanwhile, is making on-arrival COVID-19 testing mandatory for all air travelers from more than a dozen countries, including South Africa and Britain, where the Omicron variant has been detected. This decision was taken by the Indian Health Ministry and it comes into effect from tomorrow, that is December 1st. The decision was taken after a man who returned from South Africa tested positive for COVID-19, though it is not yet very clear which variant of the virus he contracted. Now let me know your thoughts in the comments on this very important story that I have done for you guys after a lot of research. You can connect with me on Instagram and on Facebook. It's @ReviewRon. Like, share and subscribe and hit the bell icon if you've already subscribed to this channel. But as always, even if you don't do any of these things, thank you so much for watching this one. Please take care of yourself and those around you. Jai Hind.